Okay, we are recording on here. And just make sure we're sharing. Welcome to our Zoom call for 2019, the day before Valentine's Day. So hopefully you guys have got your Valentine something nice to share with them and tell them that they're special. So today's Zoom call, we had a bunch of questions come in. So let's jump right to the questions and then we'll open it up for questions. Here was one of the first questions. How much protein per meal or per day is required to activate muscle building? Listen to something that said you need 30 grams of protein per meal to build muscle. I may have gotten that wrong, so could you please clarify? Well, the most important thing about building a muscle is not so much the amount of protein that you take in, but it's the amount of muscle building stimulation that a person does. Meaning that you could eat 100 grams of protein at every meal and all you do is sit on the couch all day or lie in bed all day, you're not going to build muscle. Or you could eat all carbohydrates and you could lift weights and you'll build muscle. So if you're activating muscle in your body, meaning you are exercising of some sort or lifting weights, then you will build muscle. Now, if you're going to be exercising and lifting weights and you want to build muscle faster, it would be better if you ate a little bit more protein than if you were just completely eating carbohydrates. But in truth, you could eat solid carbohydrates. As long as you were exercising, you'll still build muscle because you'll convert those carbohydrates into protein and you'll build muscle. So the most important thing about keeping away from cachexia, that is muscle loss, and trying to build muscle is to activate muscle, meaning you have to lift weights, you have to exercise. Whatever exercise, you have to contract muscles. So if you're contracting muscles, if you're contracting it against another force, that is weightlifting or some sort of exercise, then you are going to help build that muscle. But in general, for a person with cancer, how much protein should they be eating? Well, that brings us back to the question of if a person has cancer, and their cancer uh, is feeding off of uh, glutamate and methionine, glutamine and methionine. So it's feeding off of amino acids. Those people want to be on a lower protein diet. So it isn't recommended that they're counting their grams of protein and trying to get protein into their diet. If their cancer is mainly glycolytic, meaning that a cancer is mainly being fed off of sources of sugar, carbohydrates, and they are okay to eat protein, well, then they can be eating protein. Again, I wouldn't necessarily be counting my grams of protein. So it depends on what the feeding source of your cancer at this time is. Again, if I was told to eat a low protein diet where you're not eating a lot of meat, you're getting protein in your vegetables, I wouldn't be counting my grams of protein. I would be trusting in the amount of protein that I'm getting in my vegetation is fine. I would just work on setting up a muscle building exercise by doing some weights or something like that. And again, you can start with low weights. It's not like you have to be lifting, doing 30-pound curls. But if you're a bigger person, doing 30-pound curls wouldn't necessarily be a bad thing. So, but starting small with 5-pound weights or 2-pound weights if you have to, depends on where your starting point is. That's going to be the most important thing. So don't worry about counting the grams of protein. Worried about the exercise that you're doing. Next question. Wondering what is better for cancer, ozone therapy or hyperbaric oxygen? Well, the answer to that question depends on the person, and depends on the person that you're asking, I guess, because it's a matter of opinion. So my opinion is that for most cancers, you are better off doing hyperbaric oxygen therapy to help kill the cancer than ozone therapy. Now, the thought that ozone therapy is a source of oxygen really isn't really true. Well, ozone is oxygen, right? Well, ozone is O3, and what really helps ozone therapy work is that O3 is relatively unstable, and it gives off um, one of its electrons to typically biotoxins. So ozone therapy really shines in killing biotoxins, really shines with Lyme. Now there's multiple ways a person could get ozone therapy. You can inject ozone right into the tissue, and that can help stimulate an immune reaction similar to prolotherapy, where it increases the the joint fluid production and can help certain joints. And I highly recommend that if a person has a really bad joint, before they go and they do joint replacement therapy, do ozone therapy. We've had some patients experiment with ozone injected right into the tumor. Personally, we haven't seen really good success with that, really no success with that. But I know that is a therapy. Ozone therapy, ozonating blood. There's a type of IV therapy that you can put ozonate the blood. That can have some benefit. I think that shines more with Lyme, treating Lyme and mold issues than it does so much with cancer. I know that there's some cancer clinics in Mexico that do that. I'm not really convinced that that's the best therapy for cancer. Uh, and then the benefit of hyperbaric oxygen is you're increasing the oxygenation of the tissue. And if you can oxygenate a cancer, you can really help kill that cancer, because cancer tends to grow better. That's called the Warburg effect in a state of hypoxia. It stimulates lactic acid feeding, and it feeds off of lactic acid in a hypoxic state. So if you can increase oxygen to the cancer, you could help push that pathway in the other direction and slow down the growth of the cancer. So if I had to choose between two, should I do ozone therapy or should I do hyperbaric therapy? I do hyperbaric. The pros and cons go a little bit deeper than that, because one of the kind of a con of hyperbaric is all the studies with hyperbaric oxygen and cancer have been very positive, but the negative of it is all the studies are done where a person's doing hyperbaric at least usually 5 days a week. So our hyperbaric unit in our office gets very underused, simply because most of our patients are not local. So, it's not going to really be beneficial for somebody to come on a 2-day and do 2 days versus of hyperbaric oxygen, and then they go home and they don't do anymore. It's not a huge benefit there. Can it stimulate the start of a detoxification of their body? Sure. So there can be some benefit there, but it's not going to be really cancer killing doing 2 days of hyperbaric oxygen. So hyperbaric oxygen, if there's a downside to it, the downside is that you really need to do it on a very regular basis. Doing it daily would be best. Hyperbaric oxygen also shines not just with cancer, with brain issues. It's fantastic for Alzheimer's, Parkinson's issues. It's fantastic for Lyme patients with any kind of brain fog, with any kind of inflammation in their brain cancers. It's a fantastic tool. So hyperbaric oxygen is a very big positive. I wish they were really inexpensive and people could have them in their house. That would be the best use of that. But if I had to choose between the two, I would choose hyperbaric for sure. The next question is kind of long, and I'm only going to be able to answer part of this question. So you know who you are, who asked that, and the second half of it really warrants a call with Angie, and she can help you figure out the answers to this, and you'll see that as I go through this. After 2.5 years of eliminating gluten, dairy, and soy, still having a lot of bloating and gas and abdominal inflammation. What is the cause? Well, when a person has these issues, okay, I've eliminated some known allergies in my body, and I'm still food allergies, and I'm still having a lot of gut inflammation. What could be the cause? That's when we typically recommend to do a Cyrex test. A Cyrex test is a brand, it's a lab itself, Cyrex Labs. They have what's called an array 10. The array 10 is what measures a whole bunch of different foods. And I just pulled this off the internet. This is actually from an array 4, but array 10 measures, you get like 6 pages of this because there's 300 different foods that are measured in an array 10. Then you see things that are in the green, which are in the normal range, in the yellow, which are abnormal, in the red, which are way out of range. So in this case, this person, this is, I don't know whose this is, because this is just taken off the internet, casein. Casein is the protein in dairy. So this person is in the yellow for casein. If this was my patient, I'd say you have to go off of everything that's in the yellow in the red range here. So this person is very high in the whey protein, so they shouldn't be taking anything with whey protein. They shouldn't be taking anything with oats, with coffee, and with these things down here. But then you can read it a little deeper. So this is measuring casein, alpha and beta casein, and it's high. Well, you could go even deeper, which this question begs us to. Says, I realize diet, environment, epigenetics, and mutations, your genetics, play a role in what's going in and out of remission for the cancer, but at the moment, relatively increased reoccurrence. So I decided to do a Cyrex test, array 10. The results were antibody formation to 4 foods, actually a few more: pumpkin, chia seeds, Brazil nuts, pineapple, bromelain, pepper, nightshade family, and sunflower seeds. So those are this person's biggest things. This is not this person's reading, obviously, their lab. But those are the things that came up major here. But then you see this person asked the question that, in parentheses, there's no cross-reactive information was received on pumpkin and chia nuts. The cross-reactive foods to Brazil nuts were these things. So what this person is asking is, when we get a Cyrex test back like this, Cyrex gives you the data on all these every single thing tested, and every single thing tested, many of them have what are called cross-reactive foods. So understand, this test is a test for, do you have antibodies to certain foods? And typically it's a peptide of that food. So casein is the protein in cows, in dairy. So this person does not react to, has no reaction to cow's milk itself, but the protein in cow's milk they're reacting to. The whey protein, which is different than the casein protein in cow's milk, they're reacting to also. So it's breaking it down. Instead of just looking, do you have a cow's milk allergy? And if that's all the test, if someone did a different test and that's all the test measured, you'd think you'd be safe on that. But this shows that, no, you are actually reactive to different components of that. So in this case, this person's reacted to the casein and the whey protein. Just as much a person could react to chocolate milk versus regular milk, as you can see that this test measures. And the array 10 actually measures 300 plus different things. So it gets very detailed into different possible things that a person's reacting to. So who would do an array 10? Exactly somebody who wrote this question here. Still having issues, maybe gut issues. So it's really easy to say, you should do an array 10 to someone who is having gut symptoms like this person, even after eliminating some major causes of gut issues: gluten, dairy, and soy. But another person that should do an array 10 is someone who maybe they don't have any gut issues, but their Lyme disease keeps flaring up. Their mold keeps flaring up. Their cancer goes out of remission and starts growing again. What could cause that? An immune reaction of something from something could cause that. So what is that? What could that be from? Well, it certainly could be from something you're eating. So here's a person that's been staying off, and I know this patient, so they're really, really rigid. They're really, really good on their diet. So when they say they've been staying off of gluten, dairy, and soy, they've been staying off those things. And if that is true, then why are they reacting to these other things? Well, when you have a damaged gut, when you have a damaged gut, things get through the barrier. So your gut wall are your epithelial cells. And those epithelial cells have to have a tight junction. And the only thing that's supposed to get through that are small little particles of the food, the proteins, the carbohydrates of those foods that are supposed to break down via digestion in the stomach and in the intestinal tract. If you have a damaged gut wall, that border is broken. So larger particles are getting through before they're completely digested, meaning broken down to small little amino acids instead of the giant proteins. So the proteins and peptides, sections of proteins of food, are getting across the gut wall, much larger pieces than ever should, and your immune system recognizes them as enemies because they shouldn't be in the bloodstream, and you start to create antibodies against them. And then when you're exposed to that food, because you have antibodies against it, you create this inflammatory reaction, and it further damages the gut. And you end up with an inflammatory reaction. So if a person has cancer and their immune system has been doing really good for a period of time, knocking that cancer down, and they have a damaged gut wall, and they have inflammation to a food, like this person's case here, and they're still eating Brazil nuts, pumpkin seeds, chia seeds, bromelain, nightshades, they got this ramped up inflammation. Now they have less ability to fight the cancer. The cancer continues to grow or takes off out of remission again because their immune system is taken up, causing the inflammation from the antibodies, antigen-antibody reaction to the foods that they're eating. So should a person do an array 10? Who should do an array 10? Someone who has constant gut issues that we can't seem to figure out, or a person who moves out of remission and their cancer starts growing and we can't figure out why. That's where we recommend an array 10. Now, somebody asked the question, is the 23andMe test we did with you better or equivalent to the Cyrex test? It's not the same. You're not comparing apples to apples here. The 23andMe test is a genetic test. The Cyrex, is measuring, do I have antibodies to foods that I'm eating? So they're not the same. They're not the same thing. They're not at all the same. So one does not replace the other. They're measuring two different things. So this is measuring, do I have antibodies to different foods that I'm eating? And then this goes even deeper because we see a picture like this, and they should stay off of dairy after looking at this picture, and all sources of dairy, even whey protein, after looking at this picture. But also, you can look up, Cyrex gives us another sheet on just about every one of these that explains what casein is, it explains what whey protein is, and then it says, shows the other cross reactants. So there are cross reactants to whey protein, and I didn't pull up any of those sheets here, that are completely different than a whey protein because they look similar molecularly. So there can be molecular mimics to whey protein that a person could react to something else that is on that list of molecular mimic, and that's what this person that asked this question, because obviously they went over that. So Brazil nuts, the cross-reactive foods or molecular mimics are cashews, hazelnuts, pistachios, and almonds. So the first thing when I go over an array 10 is I say, you have to stay away from these things first. So let's start with those. And then they stay away from those, and 3 weeks later we talk and like, oh my gosh, my symptoms are so much better, I feel so much better. Or they're a little bit better, but not the best. Okay, now we're going to go into the cross-reactive list. You did a great job staying away from Brazil nuts, pineapple bromelain, pepper, nightshade family, and sunflower seeds, but you're still having problems, we have to look at the cross-reacted foods too. Now you're going to stay away from also cashews, hazelnuts, pistachios, almonds, the carrot family, carrots, parsley, celery, dill, fennel. So it gets kind of complicated, and it makes people very unhappy because it does limit their diet. But we have to calm down the inflammation that's in the gut. You have to calm down the inflammation that's in the gut. Staying away from these things is not a forever thing. We got to get the inflammation down to heal the gut. Because if you don't heal the gut, then you're just constantly causing inflammation. So that's how you do an array 10. And I'm not going to go into all these questions because literally it's an hour-long conversation to talk about what can we substitute now, what can we do, digging a little bit deeper. This gets very complicated. So, but this can be the answer, doing an array 10 can be the answer to what a person's problems are. So this is a great test. The problem is it gives people some bad news sometimes because it can really limit their diet. So a person's in cachexia, you can't really do this because they have to be eating some food. But we have to look at possible cross-reactants, and sometimes people aren't really happy with me when we look at these pictures, but it's really necessary. So it's a great test to do. So I always tell people we're going to go off all the yellows and reds and understand there's about 6 to 8 pages of this when we look at array 10. And then we're going to see how we're doing, and then we're going to look at cross-reactants, and we're going to go one by one on the cross-reactants and start eliminating those things. That's when it starts to really get complicated. This is a blood test. We have these available in the office. We send out the kit with the requisition form. You go get a local blood draw. It takes about a week or so to get this test back, and then we can go over it. But it can really tell you some stories of why you have problems. I used to see a lot of autoimmune patients a number of years ago. We used to run this test. Boy, it just answered all the questions that they had, and we could really solve some problems that nobody else could figure out. So it's a great test to do. We do this a lot in our office. Another question came in, said, it then seems we should still do the Cyrex if there can be some hidden issues with foods. Yes. Or does NAET testing suffice? No, there isn't any other testing that would suffice. Kinesiology does not touch these little pieces. I don't have test kits for the 300 different things that could test positive. So you really need to run the lab. There's just no substitute for it. The people who I would say don't do this would be people who really aren't going to discipline themselves to follow through with what the outcome shows. So you just got to be honest with yourself. If you're like, hey, changing my diet anywho, then don't spend the money to do the test. But people that really want to get deeper and see either why their cancer started to grow again, or why their gut hasn't calmed down, or why their headaches don't go away, or why their autoimmune issue, their rashes don't go away, or their arthritis continues to flare, then this is an extremely valuable test. So we'd highly recommend it. So if it's something that you are interested in, I would contact the office and let us know, set up a time that we could talk, or you could talk with Michelle or Ann about this, and we could go further. Okay, so I am going to open it up for questions, and whoever asks this question, don't ask me about the rest of this, because this is something that really needs to be done over a call to go deeper into that. All right, so I'm going to unmute everybody, and you are live.
Dr. Connors, how do you know when your leaky gut issue is over and that you're not forming more antibodies as you go along?
That's a good question, because many times, well, you should rerun the test. So you rerun the test in 3 to 6 months. and you see where it's at. Now, unfortunately, the truth is why do these happen? Why do I have antibodies to TEF? You have antibodies to these things. The only reason why you'll develop antibodies to a food is because you have a damaged gut, period. That's the only way you will. So if the food stays inside the intestines, it's really outside of the body. So you will not create antibodies inside the intestinal lumen. It's only when you have a damaged gut border that that proteins and peptides of these foods cross that border, and that's when your immune system fires a reaction to it. So you have to remove the source of inflammation, that is the foods that you have antibodies against, in order for your gut to start healing. And of course, you're doing some other things to help heal your gut through that time too. So once you do that and your gut starts to heal, then those antibodies will start to calm down, because each one of these antibodies have a half-life in your bloodstream, and they're all different. And there hasn't been studies on very many of them except gluten. But so I can't tell you how long it's going to take for those antibodies to dissipate. But I've had people where we've had tests that look like this. We did this again, and some of these went down to yellow, but then they had some other ones like millet went up to red, and it was in green before. What the heck? Well, it's because of your damaged gut. You were so limited on your diet, you were eating this, and because your gut was damaged, now you have antibodies to that. Well, don't get alarmed. It's just another sign that our gut is damaged. So now we're going to stay off that for a period of time. And this is down to green, so we're going to eat a little bit of that, because you got to eat something. You understand? So you're just playing with this to get your gut healed. So
it's like a seesaw. Going back and forth.
It can be like a seesaw. It's all a matter of, don't get too bummed about the food itself. The food itself is just a sign of the wall damage. So we're removing the food that's causing the inflammation. Other things are going to end up causing inflammation, most likely, but we got to get the gut healed. There's no other way to do it.
So a rotation diet isn't an option.
Yeah, and really, yes. That's why, I've said for years, a rotation diet makes sense to me. I think there was a reason why God had things grow in seasons, because you're never eating, one thing all the time. Now you can go in the grocery store, you can buy oranges just about 365 days a year. I don't think we were supposed to eat it that way. We're supposed to be changing our diet, what is in season, and having some sort of rotation going on.
So the rotation would help.
Yes.
Okay, thank you.
This is Talma. If your immune system is improving, like mine, I just took a test, it's improving, and I don't really have gut issues, does that mean that, what does that mean?
So did you just do the Cyrex 10?
No, I haven't done any of that. I haven't really had gut issues, but I'm supposed to be off the gluten and the dairy. I just took regular blood tests for neutropenia, and that's improving.
Good. So I guess the question, does everybody need to do a test like this? The answer is no, you don't. If you don't have gut symptoms, so just let's clarify one thing. Just because a person doesn't have gut symptoms doesn't mean they don't have gut issues. So let's make sure we're understanding that. So a person can have rheumatoid arthritis, and it's all caused from inflammation that began in the gut. So a person could have prostate cancer, as inflammation in the gut is a major contributor to it. So a person may not have any symptoms, and still a big part of their problem is started with, or a piece of it has to do with inflammation of the gut. So let's clarify that. But if there are other symptoms, whatever they're dealing with, their prostate cancer and their neutropenia, their other blood work is all starting to come back into normal because there's other things they're doing well. And if you're happy with the way your health is going, well, there's no need to necessarily dig any deeper. So the person that would want to dig deeper and do this test is if they're unhappy with the way their health is going. And I'm saying, regardless of what that health issue is, it can have a strong tie to inflammation in the gut. So go back to that gut check video that you all watched in my office and that you all have on your computer that says that, you know, literally all problems could begin in the gut, no matter what it is. So that's a piece of it. So that's who to want to do this.
Okay, thanks.
Dr. Connors?
Uh-huh.
Hi, it's Lisa Nagel from New Jersey. I have a question about ozone. I actually just got 4 ozone injections for my teeth.
Yes.
So I have 2 root canals like 15 years ago on the bottom molars. Every time I do a thermographic image of my dental thyroid, there's always heat there. The doctor of the thermography, he says, you know, the thyroid is probably never going to be right because my blood work, the thyroid's always off until those teeth are extracted. But he did suggest doing ozone, like two rounds this month and 2 rounds next month. And so my question is that a way to go, or that's just in the meantime?
No, I think that's a great way to go. So that's exactly the example I was using, that ozone really shines when you're dealing with biotoxins. So ozone used dentally can really be wonderful.
Okay.
So, yep, I think that's a great idea. That's a great idea.
Over getting implants, like, because I've also been doing the dental program, but still the thermographic image shows up. So just today I did the ozone. So is this something I should just do every, like the dentist said, maybe every 6 months, because she muscle tests people too, and you
probably can't do too, relatively speaking, you can't do too much ozone. She doing ozone injections?
Yes, I got like 4 today.
Do you have a root canal tooth that she's doing it on, or is it just your gums issues? Or
no, it's, well, the 2 root canals on the bottom one side. The other top was a tooth she extracted. It's still extracted there. I'm wearing a tooth piece. And then the other side is the size of my breast tumor. So she did that side. And she did all 4 quadrants. So I'm going again next week again. So is that okay?
Oh yeah, I think it's way okay. And she might even be under recommending. So I would, if I were you, I'd ask her, does she do the thermography right there too?
No,
Okay.
That's separate.
So you might want to finish what she's asked to do and say, hey, can I go do another thermography? And if it's still really hot there, will you continue to do ozone injections?
Oh, okay.
Yeah, I would say for sure.
Now, the thermographer said we have to wait 6 months after the ozone injections for the thermography to be accurate, because he said it could still show, like, in other words, he said do 2 months, rounds of it, and then do the thermography like in the fall. So I was surprised at that.
Well, I was surprised at that too, because he doesn't have, ask the thermographer if he'll do it for you a little bit cheaper without sending it in, meaning that, so one of the reasons why we have to charge what we do for thermography is we send it in to get read. So what we have done for some other patients is, partly because of my morbid curiosity of is what we're doing working, let's take some pictures and let's just see. We don't have to send them in. We'll just do some comparison pictures and see, and maybe charge you a little bit less for the thermography because he's not sending it in to get read.
Okay.
I just don't think you need to wait 6 months for crying out loud. I don't know if I'd agree with that. So I would ask to take pictures again, just even, of course they're sticking a needle in you, so that's going to be some inflammation there from the needle. But after that, that's going to calm down within a week or so. I would take pictures. I mean, if you were living right here, I'd say let's just take some pictures and see what it looks like right after you do it.
Okay. And so now what can I also use to clear out that Novocaine? What what should I do today to just...
Well, Novocaine's going to detoxify your PON1 pathway, and I don't remember what your genetic PON1 pathways look like.
I take that PON1 supplement.
So you might want to just bump that up. You're taking a couple a day, maybe take, an extra 1 or 2 a day.
Oh, okay.
Do a foot detox, do some packs over your liver, and you're doing coffee enemas a couple times a week, right?
No, I'm not.
Oh, that's right. That's right. You're one of those.
No, I just can't do everything, and I'm in a good place. So
What is wrong with you, girl?
I do the sauna. I mean, just right.
Okay, well, you're doing sauna, so that's going to help you too.
Okay, good. All right. Well, thank you for that. Well, good. All right, appreciate it.
Yep.
Thank you.
Dr. Connors, my thermography that was done in your office came up with some hot spots around my, jaw, teeth, or whatever. And I mentioned that to my dentist when I went in the next time, and they said, well, we don't know what to say because they don't see anything. I don't know if they even have a good way of detecting inflammation, but I don't have bleeding gums, or they don't see any sign of anything to be concerned about. So what does that all mean, and where do I go from here?
Yeah, you almost have to go to a biological dentist, because if you just take x-rays, and if the dentist is relying on x-rays for a quote-unquote infection, you have to have a pretty massive infection to be seen on x-ray. I mean, you would be going to the dentist because you have screaming tooth or jaw pain, and then they take an x-ray and say, oh, you have an infection. But to have a bone infection that's visible on x-ray has to be pretty bad. So going to a biological dentist, like who Lisa's going to, they understand that. So they're using different tools to assess the patient. Like the person who Lisa's going to is doing some kinesiology to assess the patient if they have an infection, because they know they can't see it on x-ray. Now there is a new little CT thing that some fancy dentist office have, but they're very expensive tools that you can do a CT type scan of your mouth, but that's not cheap, and that's radiation, and that's much more sensitive than a plain film X-ray to detect that. That's where thermography shines. We have a local dentist that's a biological dentist here that was super excited when he found out that we have thermography, because that can show an infection faster than anything else can, and that's why we put people on that tooth and gum oil a lot. That's one way to help with the infection. Now, Michelle did a whole video on dental care on a Zoom call a while back, maybe 4 or 5 months ago, that you can search through the Zoom calls and look at those, find those too. And we're actually looking at, just the other day, I was looking at another product that is beneficial. There's a certain strain of probiotic that can be extremely beneficial for infections, and I'm trying to find where we can get that. The problem is it's the one company that used to carry it. It's a strain of Acidophilus salvarius. The one company that used to carry it had it in a lozenge, and then they couldn't get it stabilized in the lozenge, so they had to pull it off the market, so that it's still in R&D. But I'm trying to find a company that has it in a capsule that then we can have people just open it up and swish it around in their mouth. That can be helpful. And then there's another product that I'm looking at carrying too that can be really helpful, because I really believe that dental health can be a major player in many cancers, especially breast cancer and head and neck and throat and upper body cancers. So dealing with that is important. So we're constantly looking for better ways to help people with that. All right, any other questions?
Dr. Connors, it's Patty in Nebraska.
Hello, Patty.
I just wanted to comment about the foot bath. I've only had it about 8 months and finally able to implement it on a more regular basis. And the result I'm seeing is for the last 2 weeks, I'm actually, the lymphoma tumor that's in my left clavicle, it's finally shrinking.
Woohoo! Yay, that's good news.
So I just wanted to share that because it's been sitting in my closet, and I'm sure others have them sitting in their closets, because you can't do everything. Right, Lisa?
You can't do everything. And I'll be the first to admit, I don't do the foot bath. I just don't have time. So,
I don't have a foot bath.
oh,
I guess I have to get one.
I would
guess
say
you do.
I've been really amazed with it. And because I'm a very strict person about everything as well, but it's been the only thing other than rest, and it only goes down and up. It just hasn't resolved. And now it's starting to resolve. So I'm hoping for more to come to keep up.
That's wonderful.
That's really,
Yeah.
really good news. That's great news. And maybe I got to start doing it too. And maybe it'll force me to sit still for 45 minutes. That would,
I'll tell you, it helps me with that part too, because then sorry, my feet are in the bath. I just can't do anything for anyone.
I like that.
Perfect. Thank you so
Thank
much
you.
for sharing that. And that we will end on that high note. So thank you very much. Make sure you post your questions on Facebook, and the person who had this question, make sure you call and set up an appointment probably with Angie would be the perfect person. All right. And we will see you guys
Thank you.
all next week.
Thank you,
Thank
Dr.
you.
Connors. Be well.
You bet. Bye-bye.
Bye-bye.